healthcare is a massive issue on the campaign trail. To that end, the Canadian Medical Association released a federal election platform. They called for reframing health. But the big debate on the campaign trail has been private healthcare, public healthcare, after the accusations from the Liberals that were called manipulated media by Twitter, that Mr. O'Toole wants more private-public synergies. Mr. O'Toole says, no, I still support universal access, but I want innovation. Well, let's find out what all that means as it's playing out. The president of the Canadian Medical Association is Dr. Katherine Smart. She joins us now. Dr. Smart, always a pleasure to have you on the program. Look, let me just begin with this debate over private and public health care. It's been key on the campaign trail. Mr. O'Toole says, look, I want to protect universal access to health care, but I want to expand what he called private and public synergies. In your view, is that a good idea? Can you do both?
I think we really strongly believe at the CMA that insured services should be available through public funding and available to all Canadians in an equal way. There's a lot of opportunity to innovate within the systems we have by adopting best practices. And we believe strongly that's a better way to go than entertaining privatization, which has the risk of only worsening structural health inequalities.
Dr. Smart, a lot of people say, look, come on, there's already so many private elements to our system. If you look at diagnostics, people have to pay for all sorts of things. Pharmacare, we've already got lots of private-public partnerships. So the idea of this universal healthcare is just a fiction. So Mr. O'Toole is just describing the reality. What do you say to that?
I think there's no question there's a lot of challenges with what we perceive to be universal health care. I think we have more of a universal illness system than we have a universal health system. And it's absolutely true that many aspects of care that people need to be healthy are not publicly funded. But I can tell you from my own experience that that is a huge barrier for people not being able to access therapists, counseling, pharmaceuticals, dietitians, rehab specialists. These are things that keep people unhealthy. And my concern is us only making that worse.
Dr. Smart, one other element. A lot of folks, including Mr. O'Toole, said, look, the Quebec model after 2005 and the Chihuly decision there, they allow, for example, MRIs. You can go get diagnostics privately and publicly. He also pointed out the Saskatchewan model on diagnostics like MRIs, saying that those are innovations. We should expand those across the rest of the country. What do you make of that?
Again, I think the question is, are these innovations or are these things that we needed in our public system that provinces wanted to implement that weren't adequately funded through public funding and through the Canadian healthcare federal transfers? So if we believe that these are things that patients need, I think we need to demand adequate funding.
Okay, so just last question on that. So when someone says, hey, we need to protect universal access, but we need more private-public synergies, at the CMA, does a red flag go up there?
I think it does because, I think that is one step towards a two-tiered healthcare system. And what we know from other countries that have gone in that direction, ultimately what it does create is two standards of healthcare, one for people who can pay and one for people who can't. So we believe strongly that our public system should be adequately funded to meet the needs of all Canadians, and that's what Canadians deserve.
Okay, you believe that's one step towards two-tiered healthcare. Okay, the CMA talked about effective responses. What does the CMA want to see from any government that comes into power?
In terms of the COVID response?
No, just in terms of reframing health, as you put out the reframing health issue today.
I think what we want to see is several things. We have the immediate emergency of the COVID pandemic that we are not through yet. We're entering a fourth wave, and we've seen varying responses across the country because there's a lack of a coordinated federal response to this emergency that's putting Canadians at risk. So that needs strong leadership. We know that we need to reframe our healthcare system. We need to improve funding so that publicly available services can be buoyed and available to Canadians, and that's going to take investments. We need to better understand the healthcare workforce. We're calling for more information, more understanding of human health resource planning and investments so that we're putting money where it needs to be to actually solve some of these problems. We are recognizing that we need more flexibility. You know, one of the positives from the pandemic has been virtual care. Well, what about expanding the way physicians can work so that we can be licensed to practice in more than one province or territory, so that we can respond to different needs across the country and also offer virtual services? And then underpinning all that, we're calling for reconciliation and racism to be addressed in our healthcare system, because again, they create ongoing structural barriers that worsen and marginalize patients.
Yeah, there's a lot to do, and that's the CMA saying, let's try to fix some of these structural inequities on all sorts of levels. Dr. Smart, I always appreciate talking to you. Thank you so much for the work that all the physicians are doing throughout this crisis and going on in the future. Thank you, Dr. Smart, President of the CMA.
Thank you.